Hello, and welcome to a series of presentations on MassHealth and Medicare, brought to you by the Northern Hilltown Consortium of Councils on Aging and funded by a service incentive grant from the Executive Office of Elder Affairs. My name is Deborah Hollingworth, and the information you're going to hear today has been gathered from about 25 years of observations as I help folks, individuals and their families, understand eligibility requirements, regulations, and the benefit programs of both Medicare and MassHealth. But today's focus will be on who pays the nursing home bill. Let's pause for a moment and talk about the difference between Medicare and Medicaid. Here in Massachusetts, Medicaid we call MassHealth. So you'll hear me say the difference between Medicare and MassHealth. Folks confuse these two insurances pretty commonly, and that's understandable since they were created at the same moment in time. Here's a picture of Lyndon Johnson as he was signing this into law at 3 o'clock in the afternoon in Independence, Missouri, July 30th, 1965. If you are over 60 and you're looking at this photograph, you'll probably recognize Lyndon Johnson and Lady Bird standing slightly behind him, and perhaps you'll even recognize Harry Truman, and that's Bess with him. Harry's there because he tried gallantly and unsuccessfully to pass universal health care right after World War II, but he didn't have the votes in Congress to do it. It took 20 years for Lyndon Johnson to make that happen, and Medicare was the first universal coverage. Who pays the nursing home bill seemed to be a good place to start, because this question creates a lot of anxiety for folks, and usually they need this information in a pretty stressful time. Less than 5% of us ever end up really needing permanent nursing home placement, but a lot of us will need rehab services at a nursing home. This could be after a medical event like getting a knee replacement, hip surgery. It could be that you have a stroke or a cardiac event and you find yourself needing nursing home services just for rehab. And these services are paid for by Medicare. Medicare is a federal program. It's the same in all 50 states. I don't care if you're in Hawaii, Arizona, Massachusetts, it's the same. And the eligibility requirements for Medicare are pretty straightforward. If you've paid into Social Security and you turn 65, you become eligible for Medicare. Some folks younger than 65 can get Medicare benefits, and that's if they're disabled and collecting Social Security disability benefits. MassHealth, or Medicaid, is a federal program, but it's not necessarily the same in all 50 states. The New England states are pretty similar in the eligibility requirements, but Massachusetts has a more comprehensive number of MassHealth programs, and certainly might be characterized as being more generous in terms of the coverage it provides. Certainly quite different than your experience might be if you lived in Arkansas. MassHealth is funded by both state and federal funds, and this is why there is a difference between states in terms of the kind of coverage that MassHealth provides. Okay, so who pays the nursing home bill? This will be Medicare. And those folks who need rehab services, usually that starts with a hospitalization, a medical event that triggered your need for a hospital admission. Maybe you had planned surgery, or maybe this is a result of an unplanned event where you find yourself in the hospital for a few days and then discharged to a nursing home for rehab. In these cases, Medicare will pay for the first 20 days, and then after that, Medicare is going to be paying $185 a day for day 20 through 100, usually. There are some rules, and we'll start with the 3 midnight rule, because this is really generally misunderstood. You find yourself in the hospital, you're receiving some kind of treatment or medical care, you're there for a number of days, and then you're discharged to a nursing home. If you have been there 3 midnights and you have actually been, and this is important, you have actually been admitted to the hospital, then Medicare is going to pay for your nursing home rehab. If you've been in the hospital a few days, but you weren't admitted, you were there under observation, and then discharged to a nursing home, Medicare is not going to cover that. So the important thing to remember here is if you're in the hospital receiving services, or you think you're receiving services, you need to have been admitted. Here's an example. Mom is 92. She takes a fall. Her daughter finds her on the floor, and it's a 911 event. When she's in the emergency room at the hospital, it's determined that she has fractured her collarbone. And she's there for a couple of days and then discharged to rehab to get her strength back so that she can use her walker. If you've ever had a broken or a fractured collarbone, you know it's really hard, especially at 92, to lift your walker. So now Mom needs help transferring from a bed to the chair. She needs help walking. She can't really stand long enough to make her meals, and rehab is indicated till she gets her strength back. Her daughter gets a call after Mom's been in rehab 3 or 4 days, and it's from the billing department. They want to know how Mom's going to pay her bill at $465 a day. The daughter's confused. I get the phone call, and the daughter says, wouldn't her Medicare insurance be paying? What we discovered when we looked further into the situation, Mom had been in the hospital under observation. She hadn't gotten any surgery. She hadn't really received any treatment. She was just there as a 92-year-old trying to determine that nothing else was needed. She needed rehab. At the end of that, they discharged her, and someone failed to notice that Mom had never been admitted to the hospital. She was just there under observation. So now the daughter has a choice. She can find a way to pay the $465 a day or take Mom home. And we'll talk about that in a future presentation. Let's just say you're told, oh, well, you're here under observation. You haven't actually been admitted. You could say, I need to be admitted if you're going to discharge me to rehab. Otherwise, my insurance won't pay. And you can ask for a patient advocate. You can ask for your doctor to make a recommendation that you be admitted. The hospital is going to be savvy enough to understand if you say, I don't have the kind of insurance that will pay for my rehab if I am not actually admitted to the hospital. But here's another example. This time, Mom and the daughter are walking across the parking lot, going to a restaurant for lunch. The daughter told me the next day, Mom fell and I could hear her bones snap. Mom's treated in the emergency room where they determined she's got a broken leg, but it was probably due to a freak accident in terms of a fall. She has a history of osteoporosis. They put her in plaster, so she has a plaster cast, and they discharged her home. The call I got from that daughter the next morning was that Mom's home in bed with a plaster cast on her leg, and she can't get up, she can't stand, she can't dress herself, she can't get to the bathroom. What am I going to do? And the first question I asked was, what kind of insurance does she have? The daughter said Mom had a Medicare Advantage plan as a supplement to her Medicare. My next question, does her doctor know she's home with a plaster cast? And the daughter didn't think so, because of course Mom had been seen in the ER at the hospital the day before. call the doctor, and the doctor with a managed care plan has the ability to order nursing home rehab, which the doctor did. And mom went straight from home to a nursing home. So that's a way around the 3 midnight rule. And the thing to remember from this is for those folks who have been admitted to the hospital, your Medicare is going to pay for rehab. If you have been in the hospital and you've just been there under observation, Medicare is not going to pay for your rehab unless you have the type of Medicare supplement called a Medicare Advantage plan that allows your doctor to make a referral for rehab without a hospitalization first. This brings us to the most frequently asked question, doesn't Medicare pay for 100 days of rehab? Sometimes, but the fine print actually says Medicare can pay up to 100 days of rehab. And in order for Medicare to keep paying for your rehab, you have to keep showing improvement each day. So if you're there after a hip replacement and you're working with a physical therapist, that physical therapist has to be able to document that you walked 10 steps further today or you climbed 3 steps more in order for Medicare to continue to pay your bill. If you reach a point where you have plateaued, or if you do not choose to participate in your rehab, or you're unable to participate in your rehab, then Medicare cannot pay the bill. So what happens at that point? The nursing home will issue you a discharge. And they're really meaning you're being discharged from Medicare. Can you stay in the nursing home? Sure, but Medicare will no longer be paying your bill. Which brings us to the next question. Who pays the bill? If you're in rehab, you need to stay in the nursing home, but you're no longer able to participate in rehab. At that point, you can pay privately for your nursing home care, or you may be able to, if you're fortunate, have a long-term care insurance policy, or in some cases you may take a look at whether or not you can qualify for MassHealth. So let's start with the paying privately for a nursing home. A lot of folks don't realize that nursing home will cost between $10,000 and $14,000 a month. This will quickly deplete your assets if you're looking at a nursing home stay of more than a few months. Some folks will have a long-term care insurance policy, and these policies are designed to help pay your nursing home bill if you ever need to be admitted. They're also pretty pricey, and the more you pay for a long-term care policy, the better the coverage. Policy can cost anywhere from $3,000 to $5,000 a year. The average age of a Massachusetts resident purchasing a long-term care insurance policy is about 62. And that's when you begin to think about protecting your assets or the possibility that you might need nursing home care at some point in your future. And then there are folks who can't pay privately, do not have a long-term care policy, and they may look at becoming eligible for MassHealth to pay their nursing home bill. And this will be our next presentation, part 2 of who pays the nursing home bill if you need to stay longer than Medicare will pay. So in summary, the 3 things to remember. If you ever find yourself in the hospital, ask if you've been admitted, or are you just there under observation? If you are going to be referred for rehab, do you have a Medicare supplement plan that allows your doctor just to make a referral without having been there 3 midnights in the hospital? And finally, if you find yourself in rehab, are you making enough progress for Medicare to continue to pay your bill? I want to thank you for joining us today. And if you have more questions or need further resources, you can contact your local senior center, ask for a Shine counselor. For those of you folks who may not be familiar with SHINE, this is a nonprofit organization that helps seniors or anyone else with their insurance, their medical insurance questions. It's a free consultation. SHINE counselors, sometimes called SHIP counselors, are available in every state of the Union. You can also Google AAA, that is not the travel agency, but the Area Agency on Aging. And when you do that, you can find by zip code a SHINE or SHIP counselor in the area where you live. Thanks again for joining us, and look forward to seeing you again for our next segment, which will be who pays the nursing home bill if you need to stay longer than Medicare wants to pay. Thank you.